Hi, CAP School. This is Elena Peters. I'm an occupational therapy student, and this is my presentation on occupational therapy and sensory interventions. So, first, we're going to talk a little bit about what occupational therapy is, and it is using a holistic approach to help you get back to participating in activities and occupations that mean the most to you. So it actually has its roots in the arts and crafts approach, which was used in the 1900s to help engage injured veterans post World War I. It is an evidence-based practice, so we do research and we make sure that we are implementing best practice when we are out in the field. And then we also provide services to a variety of age ranges and settings. So some of those could be mental health, home health, skilled nursing facility, hand therapy, work conditioning, work hardening, pediatric outpatient, school system, acute care, which is in the hospital, early intervention, and even more. So there's lots and lots of places where occupational therapy can be used, but it makes sense because anywhere where somebody's going to have issues engaging in their daily activities is an area where we can help. So next I'm going to talk about some of the approaches to interventions that occupational therapists use. So the first one is behavioral modification. Wow, that sounds familiar. And its positive or negative reinforcement is used to elicit a desired response. So an example of that would be in a public school setting, an occupational therapist asks a student to write 3 sentences after which he may choose an activity that he would like to do. The next approach to intervention that we have is cognitive behavioral. So people are taught to replace behaviors that result from abnormal thought processes with a more normal or adaptive thought process and behaviors. An example of that one would be an occupational therapist helps a young woman with Down syndrome learn that she does not need to be afraid to use the bathroom all by herself. The next one is sensory integration, which I'm going to go into more in this presentation later, but it's based on the way your brain receives sensory input from the environment and organizes it so that the body can respond with an action. So an example of this is an occupational therapist helps a child with attention deficit hyperactivity disorder, ADHD, to participate in vestibular swinging to organize and calm his neurological system so that he can sit still in the classroom. And finally, last one I'm going to talk about is person, environment, occupation. So I feel like this one applies a lot to ABA too, because you look at the child, you look at the environment that they're in, and then you also look at what they're trying to do. And that's what the PEO model tries to do. So it looks at the interactions of these 3 domains to improve occupational performance. So the best occupational performance is where you take into account all those different domains so that you get the best crossover. So an example of this would be in a home health setting, an occupational therapist works with a woman with muscular dystrophy to adapt the bathroom in her new home so that she can shower independently. So next I'm going to talk about sensory integration. So it's really interesting because it's not only an approach we use to our treatment, but it is also an intervention type that we use. So it's actually a treatment that we use as well. So sensory integration, as defined by Ayers, is the process of organizing sensory input so that the brain produces a useful body response and also useful perceptions, emotions, and thoughts. So also going into that would be sensory processing, so how the process works, and it's the method and manner of sensation detection and transmission through the central nervous system. So interestingly enough, if I was here in front of you right now, instead of doing a movie, I would ask everybody what their senses are. So you know your 5 senses, which are sight, sound, taste, smell, and touch. But there are actually 3 other senses that we don't have that you don't normally think about having. But when I talk about them, you're going to be like, oh, that makes sense. That is a sensation that I feel. So first one is proprioception, and this is the feedback you receive from the muscles stretching and retracting. And it's the feedback you get from your joints when moving. So when you're standing up and you're walking, that feedback that you're getting, it's not a touch feedback, it's almost like a deep pressure internal feedback that you get. That is proprioception. And then we have vestibular sense. So the vestibular is your inner ear responses, how your head is positioned in space. It's also your balance responses and your reaction to gravity. So sometimes you hear about, people having like inner ear problems and their balance is all off. That's this sense. So you could understand how if a child is afraid to jump or move quickly because they don't feel confident in their balance, how that would be a sensation they're receiving that's throwing them off. And then I have visceral feedback or the visceral sense. So that's the feedback from internal organs and major blood vessels that regulate blood pressure and tell you if you're like hungry or full. So it's kind of like thinking about your internal organ feedback. And it sounds really strange and kind of out there, but it makes sense when sometimes you feel something internally and you're like, oh, but you can tell exactly where it is. That's a visceral sense. So in sensory integration overall, it is this neurological process. And when you're thinking about it, you're thinking about how your body is receiving all of these signals from the outside. And it would be clear to see that if you're not receiving one of these signals correctly, if your body can't process it correctly, how there can be a lot of issues because your body doesn't understand what's going on. So I'm going to go more into sensory integration on the next slide. So now I'm going to talk about why sensory integration is important. So it's important because if a child has a sensory integration problem, they're not going to just grow out of it. It's not going to just go away. They can learn ways to compensate, but it's never just going to go away. They're not going to grow out of it. So some of the central principles of therapy for sensory integration are to provide controlled sensory input in such a way that the child develops an adaptive response to the stimulus and to integrate these sensations. So this would be if a child does not enjoy, putting their hand in wet paint or having their hand wet, it's building up their response to that stimulus in a way that they're not getting overly upset about it, but it's also kind of like a build up to the response. But once they integrate that pathway and that knowledge of that stimulus, then they've integrated it and they're going to understand it and they're going to be able to react appropriately to it. So that also goes back to successfully responding to the challenge and the acquisition of new abilities to contribute to the development of sensory integration in the nervous system. So that's making sure that the challenge is just right for the child, that it's not too difficult where they're going to get frustrated, but it's also not testing things that they've already had integrated. So why does it work? So sensory integration works because the brain is designed so that the functions that are used, so things that are used every day, things that we learn, are the functions that are most likely to develop. So the ones that are the most likely to be integrated into our sensory system. So it's almost like if you don't use it, you lose it. So here's my example of why it's important for sensory integration. So if you have a child with sensory integration and they have disorganized postural and eye muscle responses, they may eventually learn how to play baseball and write with a pencil. But to do this, they can do it in spite of everything that they have with their difficulties. But the practice and effort of these splinter skills that they learn to have a functional task will leave the child with less energy to do other things. So the child's not going to have as much energy after writing a big assignment because they have to focus so hard because it's such a difficult task for them. So jumping right into some disorders that are treated by sensory integration. I've already mentioned some of them, but it makes sense that they go into all the different senses and some of the discrepancies that can happen if those senses aren't working properly. So there's ones with the vestibular system. So the picture I have right now could definitely be working with a child who has either an under-responsive vestibular system or over-responsive vestibular system. So it could help to get them used to that movement and to be responding correctly to that movement. There's also developmental dyspraxia, which is a disorder characterized by the impairment of the ability to plan and carry out sensory and motor tasks. So these can be children that look a little bit awkward to walk around, that not all of their walking patterns and movements are very smooth or what you would consider to be like rhythmic. And just because a child doesn't walk right doesn't mean they have this. This would be something that would be diagnosed by a sensory integration professional. Tactile defensiveness. So I think we all can think of a child that doesn't like to be touched, that's extra sensitive to touches on the skin, and that they turn away from them or get very upset from those touches. So there's a way to work on the responses to that. And then finally, visual perception and auditory language disorders. So those are going to be with children who struggle hearing and struggle speaking, but it comes about a way that they're not able to read words to speak them, or they're not hearing the words correctly to be able to process them and understand them. So those are some of the disorders that sensory integration addresses. So that was kind of my quick and dirty introduction to occupational therapy and sensory integration techniques. All the information I got was pulled from this book by Ayers, and it is basically the book that we use to drive our sensory integration interventions. So for giving you a holistic view of everything with occupational therapy, occupational therapists treat sensory things a lot of the time, but there are trained professionals that have more certifications in sensory integrations and that actually specialize in it. If you're in a pediatric setting, that's typically the person that you're going to see is going to be a professional and trained in sensory integration. So I really recommend that if you guys can get just one of these books, that it would be really, really helpful. It's honestly a quick read. It's written a little bit like a textbook, but it only has like 120 pages, and it has some really great references and a lot of good question and answer things when it comes to sensory, and I feel like it would be a really good resource for you guys to have. So thank you for listening to my presentation, and I hope you guys have a great day.